So in this video, let us see the 7 common mistakes of flap planning. Now these are the common mistakes which I used to make, I still make. Yours might be different. So please mention about the mistakes you make in the flap planning in the comment section so that others might be benefited because of it and even I'll be benefited because of it. So let's move on to the mistakes of flap planning. Now, first of all, we have to plan any flap in reverse. The first and most important thing is the important anatomical landmarks are to be marked, and they are to be marked in a proper anatomical position. Now, many times we miss marking the bony landmarks, we miss marking the septum between which the axial vessel is going to course, and the position of the extremity is not marked as it should be. It is not kept as it should be. One of the most important and common examples of this is the posterior interosseous artery flap. Now it is typically described that the PIA flap should be marked, should be elevated with the extremity, with the hand in prone position on the chest of the patient. So very commonly what happens is that if we are not able to do the markings in this position, the axis of the septum might be deviated a bit than what it originally is. So we need to do the markings with the hand in pronation and then go ahead with the flap harvest. So this was about marking of the important anatomical landmarks. It should be marked. It should be the first step in any planning. Now, the second common mistake is that we don't consider the thickness of the skin. So we make a template, we mark the template. The template is basically whatever piece of cloth we are using. So it is not as thick as the thickness of the skin. So our flap is invariably planned short. So we need to take the thickness of the particular area into consideration. Now, if the skin thickness is excessive, then again what happens is more amount of tissue is required at the pivot point, and if that is not taken into consideration, our flap invariably falls short. So that is the importance of skin thickness and pivot point. More the thickness, larger the or longer the flap, and pivot point